The one person really working hard. Okay. Okay, good. For the Is that going to be high enough? Okay. For the next person, I want to introduce somebody very near and dear to me. It happens to be my daughter, Shana. Shana is a graduate of Touro. She has a BS from Touro in psychology. She also has 2 masters, and she's a psychologist, and she has a graduate, as I may say, proudly summa cum laude. So she's going to talk to us about seasonal affective disorder. Shana, thank you.
Hello, can everybody hear me? Awesome. Okay. Well, thank you so much for that introduction. That was awesome. If you can look at the first slide, this is exactly how I feel in the winter time. I think a lot of you will agree with me. Seasonal affective disorder is actually commonly known as SAD. So if you hear me say SAD a couple times, that's what I actually mean. And we're going to talk about a couple different things. So what is SAD? We're going to talk about who gets SAD, what the causes of SAD are, what the signs and symptoms, the treatment and coping skills. And if you have any questions, you can talk to me after we finish all the speeches. Okay, so what is SAD? Seasonal affective disorder is a type of winter depression that only affects you during the winter and fall months. It's believed to be caused by an imbalance of chemicals in the brain, and it's winter there to decrease the amount of natural light that reaches us, which is due to because of less daylight hours, which we actually are experiencing right now because we just turned the clocks back last week. So now if you I experienced this week is that I was actually tired earlier and I woke up actually earlier because my clock was all over the place. So this is actually perfect timing. And the reason we have less light that we actually experience in their day is because we have less daylight hours, and it's due to changing weather and patterns. And the lack of sunlight actually caused a reduction in serotonin and an increase in our melatonin. And if you know anything about serotonin, it actually helps you be happy. And melatonin is actually proven to make us tired, because especially if you have sleeping problems, the doctor might give you some melatonin, which actually explains a lot why we actually have seasonal affective disorder. Okay, so when does seasonal affective disorder occur? So it occurs during the fall winter months, which is like October to April. So that's the big time you can get it. Most people are affected actually during January and February is when they actually have it the worst. So anybody know the actual causes of seasonal affective disorder? There actually are no proven causes of why people actually get it. Anybody can get it in this room and you will not even know why you get it. Some people say it's that we just talked about decreased amount of sunlight, and some it's because daylight hours we don't have anymore, and sometimes it's because just our body clock changes because our sleep schedule changes, which is why we're affected by it. And some people can have depression, and some changes you don't even know why. So there's not 100% actual reason why people really get it. So what are the types of symptoms we're going to have? Symptoms we're going to have. So sleeping problems, not be able to stay awake, having disturbed sleep, like we talked about, like if you go to bed too early, you actually wake up in the middle of the night and then your whole sleep schedule is totally ruined, and then you wake up in the morning and you feel like you have no energy. Depression, it only occurs in the winter months. You're only going to have depression in the winter months. And also you include a loss of feeling. For example, like certain activities that you do throughout the year that you really experience happiness through, you're actually not going to feel any emotion. And there may be certain things that make you angry. You're not going to feel anything for them. Social problems. Basically, you're going to avoid social situations that you do, which usually happens during depression. You're not going to want to go hang out with your friends. You're not going to want to go out to dinner. You're not going to want to go to shul. So that's a big symptom that we have. Also, mood changes. You're going to have increased amount of being angry, sad, and it's going to go up and down. So there's not going to be actually like a set reason why you have these moods. And also, women have increase in PMS. Diet changes. We tend to overeat if you have SAD. And we also are really drawn to heavy carb food and sugar, which actually makes you feel less like you want to go out and less like you have more anxiety, because if you gain weight, you really don't want to go anywhere. So you're going to increase, and also you've lost libido, and we just talked about increased anxiety and weakness in your immune system. So these are all symptoms of SAD. So how do you know if you have SAD? It usually takes 2 years to be diagnosed with SAD because it only occurs in the winter months. For example, you're suddenly getting depressed during October, November time, and then it hits April and you're totally fine. Like all your symptoms, your depression just goes away. But then next winter comes around and you feel it all over again. So that's how you know you have SAD. But you don't want to wait 2 years to get diagnosed. So if you actually have any of these type of symptoms, you want to see somebody as soon as possible and not wait the 2 years to actually know you have SAD. Because it could be some other disorder and other type of depression that you have. You're not going to experience sadness all the time, which is actually very different than other depressions. Because usually when you have depression, you actually experience it all the time, every day. Some days could be worse than others, and some days you will be better. But you're going to actually feel depressed all the time. With SAD, you actually do not feel depressed all the time. You can have days that you're totally fine, which is actually one of the reasons you can figure out you have SAD, because if you're not depressed all the time and all of a sudden you're like not wanting to go anywhere, you realize there's something going on. And also, there's no other reason for your mood changes. So basically, you have a good life, you have a good job, you have a good social life, you have money in the bank. So there's no reason you should actually be depressed. So that is actually also a reason you have SAD, because usually when you have depression, there are other underlying issues to why you have it, and also things going on in your life. This is not the case in SAD. So that's how you know you have SAD. So what do you do if you have SAD? So now we're going to talk about the treatments, how to help yourself. There's counseling, there's medication, there's light therapy, exercise, sleep cycles, very important, support for your family, nutrition, decrease in alcohol use. Make sure you don't drink too much, because some people tend to do that when they're depressed. Spend time outdoors. Education in your family is very important. Stress management, and consult your physician if you're feeling any of these type of symptoms. These are all important ways of doing treatment. So we're going to discuss a couple different ones in more detail. Okay, there's 3 traditional type of treatments that usually are suggested if you have SAD. There's light therapy, there's talk therapy, and there's medication. So we're going to first talk about light therapy. So you feel like you have these symptoms, you go to your doctor, and they suggest light therapy. Usually you'll get the light through your physician and your insurance. They also sell them online. So the light is like a white light that you sit under, and it's suggested to sit under it in the morning time, actually. It may suggest about 15 to 20 minutes. Some people need longer time. 15 to 20 minutes isn't going to work for them. They need like 20 to 30 to 40 minutes. And some people actually do it twice a day. They do it in the morning time and they do it at night. But it's usually suggested in the morning. And because the light actually simulates the light you usually would feel during the daytime, which we don't have anymore because it starts to become very depressing and dark outside. Talk therapy. So it's very important sometimes to go to a therapist to talk about your problems. And also going to a therapist will also figure out what type of treatment's best for you. Because you can't just figure out what treatment you want to do by yourself, because it's not really going to work most of the time. Also, you can't get a medication without, going to a therapist. So you're going to go to talk therapy, and usually this works a lot better for people. Actually, talk therapy is the most suggested one, and actually talk therapy with light therapy combined. Medication is also good to do with talk therapy. You really don't want to do light therapy or medication really by themselves. You want to do them together. And they suggest medication also, like I just talked about. Then you want to go to your doctor. And antidepressants that actually increase your serotonin levels, which we discussed earlier that actually are decreased in the winter months and fall months because of less sunlight. So actually serotonin can actually help you because it will increase your serotonin levels. Some medications don't work for everybody. And they have some side effects, which is they have more side effects than light therapy. Light therapy, the only big side effect is headaches, which with medication, you have a lot more side effects. It can be nausea, it could be bloating, it could be stomach issues, headaches, other issues. And also it can take time to find the right medication for you because not every SRI actually works for every single person and not every dosage works. So it can take a while really to find the right dosage for you and right medication. So you have to be patient with that. There are a couple other type of less traditional things that we use to actually help with SAD. For example, rearranging your workspace. For example, if you have like a window in your office, they said to open the curtains up, and if you actually can open your window to let the air in, because that will actually really help. Number one, you'll actually be able to bring light in from outside, which actually help, which is what we actually want with SAD, and also the fresh air. It all really actually helps. If you do not have a window, because not everybody does, you actually are going to want to bring in a bright white light into your office, and you're going to want to bring maybe a plant or something that actually all help stimulate what you could actually get outside. Some people like to keep daily logs about their daily life. They like to keep about what symptoms they're feeling that day, how much they ate, how they exercise. Some people find it very helpful and therapeutic to do that with SAD. The other is to make sure we talked about again is to have a good sleep cycle. We talked about how by not having a good sleep cycle, you can actually wake up the next day feeling very unenergized. And they actually say that sleep cycle is one of the biggest causes of SAD. So it's very good to have a very good sleep schedule. Another thing is actually dress warm for the outside temperatures. Because number one, dressing warm, you'll actually conserve your energy. And number two, it also helps you actually want to go outside. Because later we're going to talk about one of the best things they actually say to prevent SAD is actually going outside and doing outdoor activities during the winter and fall months. Okay, so when you seek help, it's very important to seek help the minute you feel any type of symptom. Because you don't want to wait. Number one, the longer we wait, the less likely we're actually going to go get help. And number two, especially if you have symptoms that actually make you feel like you're going to harm yourself or others, you need to get help as soon as possible. Okay, so prevention. Sometimes there's ways to actually prevent SAD before they happen, especially if you know and you're actually prone to having SAD. And sometimes we're just all prone to a little bit of winter blues. We can all get it. It happens. So things that do something that'll make you feel good. For example, get a haircut, get a new outfit, go golfing, go swimming, whatever you like to do that makes you happy, go do it. Get exercise. It's very important to get exercise in the winter months. Number one, it boosts our serotonin level, which makes us happier. Number one, it makes you feel like you did something. I know, for example, me, I love to go exercise because it makes me feel good about myself after. It's a very important mood booster that we need in the winter months. Number two is to take short naps, which is kind of funny to talk about that after exercise. Taking short naps is very important. Number two, it's because our melatonin levels are actually increased in the winter months, which causes us to be more tired. So by taking a 5-minute, short-minute nap, you actually will boost your energy for the day. So it's very important to actually do. Try to do outdoor activities, like we talked about earlier. By going outside, number one, you have the rays of the light going on you that if you actually have them outside. And number two, it's important because we actually are active, which also helps boost our serotonin levels. So it's very important to go outside. I know in the winter months, we really don't want to go outside most of the time, and it's really hard to actually go outside. But just actually taking like a walk around the block for a couple of minutes actually just really help for the rest of your day. Spend time with loved ones. One of the symptoms of SAD is not wanting to do activities. By actually forcing yourself to go outside and do an activity with people, it would actually really help you and your symptoms of SAD and not having them, because once you go out the door and you actually start to be social, your mood really does change. When you're inside the house, you don't feel like you really want to go anywhere. But it really helps. Develop a sleep routine like we talked about earlier, and eating healthy. Eating healthy is very important. Number one, it helps with energy throughout the day. It helps your mind. So it's very important to eat healthy. There are a couple of actually mood-enhancing foods that we can eat that actually will help us be happy. So they're like superfoods for your moods. There's fish, like tuna, sardines, mackerel, like over here. There's nuts and seeds, like Brazilian nuts, pistachio nuts, pumpkin, flax seeds, dark chocolate in moderation. Everything's good in moderation. There's fruit, and there's lots of water. So thank you guys for listening, and if you have any questions, you're welcome to ask. Bye.
Most of the time when people talk about SAD, they only mention light. You're the first person I heard that mentions the cold weather and maybe snowstorms that contribute to it.
Yeah, they do. They say the weather patterns, mostly because the weather patterns attribute to because they cause less sunlight outside. And they cause also you guys not really want to go outside and not let do outdoor activities, which all are symptoms of why SAD happens to people, because they're less active, they're less social, and we don't actually experience the sunlight, which reduces our serotonin levels. So these are all reasons why we have SAD.
She soon will be available for counseling. If anybody wants to know, come to me, and we will. We're setting up an office. Okay, thank you very much. I want to introduce a very good friend of mine, and Dr. Elimelech Goldstein, who's the founder of Hatzalah. I want to say a couple things about Dr. Goldstein. We all know the tremendous things he does for our community. We all know that. We almost take that for granted. I know him also in medical practice, and I want to say all the years that I was with Good Samaritan Hospital, the most talented person who ever came through Good Samaritan Hospital was Dr. Elimelech Goldstein. I want to tell you this. The most talented person who ever came through, the most innovative person who's there. So I'm going to introduce Dr. Goldstein again. Matt, why don't you come over here and talk to us about some regard safe proofing our house during the winter time. Thank you, Matt.